So it's greatly improved. Is that fair?
Greatly, greatly improved. I mean, it's very, very getting emotional.
It's much better.
Yeah, very much. I mean, much, much better.
So where are you from?
I'm from Tyler, Texas, but originally from Los Angeles. I had this pain since 1982.
Okay.
It started like a toothache.
Mhm.
I lost a tooth in the process. Requested to have the adjacent tooth to be extracted to the disgust of my dentist. But the pain seemed to move to the next tooth, and that was when I was referred to a research clinic, TMJ Research Clinic, was fitted a splint, given Elavil, progressively increasing dosage until I almost had an accident. So I stopped with the experiment, with the research plan. And from that time on, that was way back 1982, I've been hopping from one pain specialist to another, with ending up taking prescription, very potent pain prescription
Yes.
that is addicting.
Yes.
And that was almost 32 years.
Describe your pain. When did it happen? Where did it happen? Was it up in the head? Can you point to it?
Well, as I stated earlier, it felt like a toothache on the upper part,
On the right side?
on the right side.
Okay.
And I could relieve the pain by just patting it, and the
Okay.
pain would go. Then it'd come up again, I would pat it. But then slowly progressed. I had acupuncture treatment, chiropractic massage, hot, cold compress application, splint. But the problem is, whenever I have dental work, then adjustments would be done on the splint until it became, it was not really helping, but it was just preventing me from grinding, but it did not help with the pain at all.
Who did you see? You went to the research clinic, you saw your dentist. You say you saw numerous pain people. Did you see other TMJ specialists over the years, other dentists?
Oh yeah, one of the
ENTs?
main dentists at UCLA started to treat me. He's a pain specialist.
Yeah.
He injected right here on my face on 3 occasions, 3 visits,
Okay.
and it did not help me. So I was prescribed amitriptyline, all down through the years, nortriptyline, all this other pain medication, Pamilor, Elavil, but the only medication that really helped me is the latest one that I am still taking, is fiorinol with codeine, or derivative Ascomp with codeine lately.
Did they ever give you muscle relaxers? Does that ring a bell?
Yeah, I had Valium
Mhm.
at night.
Did it help?
It helped.
So the splint wasn't definitive. It didn't. It helped you not grind so much, but the pain was still there.
The pain is still there, and the jaw feels tired in the morning,
Right.
both sides.
Okay, so it's been 4 days since we did things. What's different? How have you been?
Oh, after the treatment, the chattering of the teeth has stopped significant. I mean, down to just stable. I mean, no chattering at all. The tightness on my cheek around this area is gone. There's the bite is, I mean, I could say that it's completely corrected.
feels more even.
It's more even.
Right.
I could enunciate words better than originally,
Excellent.
and I don't get the quivering, boring, what's
Pain.
the-
Spasm.
yeah, spasm
Okay.
anymore.
Are you taking any medication? I mean, are you kind of laid off of that now, or?
Well, from the treatment, from the day of the treatment, I stopped taking. Oh, even before the treatment,
I think you were off at 2 days. You told
I
me
was
when-
off for 3 days.
Yes.
I mean, preparing for this treatment to see how intense the pain is, and even after the treatment, I did not take medication for 2 days after, or 3 days after. This is the third day.
So you've been off at 4 or 5 days now.
Yeah,
And how are you feeling? Are you?
I mean, I could survive without the pain.
Yes.
I mean, without the pain medication.
So it's greatly improved. Is that fair?
Greatly improved. I mean, it's very, very, getting emotional.
It's much better.
Yeah, very much, I mean, much better.
On a scale of 0 to 10, before we did it, what was your pain level on average? A 1 out of 10, a 10 out of 10, an 8 out of 10?
When we started,
Before we started.
Before
like
we started?
Last month, last year. Give me a
I
number.
mean, the maximum, not
Average.
9, 10. 7, 8 is the regular daily
What
level
is it
of
now?
pain.
It's 4 days later. What's it like
Right
now?
now, it's like 2, 3.
2, 3. So a
And-
great improvement.
Yeah, and the chattering has stopped completely. The tightness,
That's excellent.
it's just like very soft, very dull,
And subtle.
subtle pain.
hmm we worried about you because on your MRI, the cartilage wasn't quite right. So, anytime we have damage to the joints themselves, the cartilage in particular, the bone, we worry about stability over the years. That's the one thing. But the way I look at it, we've caught your bite up to your joint. What does that mean? That means, your joint is a point, your right side, your left side is another point, and then your teeth are like the third point. So you have 3 points. So it's like a door, the lower jaw with 2 hinges, the 2 TMJs. We need to get the teeth to fit to where the hinges want it to be comfortably. And we've done that. So now it's a matter of, will your stability remain? Will the joints stay stable? And I would argue that over time it should, because now you're imparting less hyperactive muscle activity to the whole complex.
I could feel that.
It should, I wish I could promise this is lasting. We'll see. I mean, obviously you're doing better, and I would love to hear from you a year from now telling me that you're still good, or even more improved. Because typically, it'll take about a month. A month from now is pretty much how it's going to be. Right now you're still going to be a little sore, and like you said, 2 out of 3. I'm hoping you're going to be like a 0 or 1 out of 10. By the time a month goes by, we'll see. Is your husband glad you had it done? He is. He's smiling. He's giggling.
Because he's suffering from the side effect of the medication.
Okay.
Short-term.
Are you glad she had it done?
Oh, sure.
Good answer.
Christmas will be. I have till Christmas now.
All right, so the bottom line, you're glad you had it done, right?
Oh yes, definitely.
Okay, excellent. Thank you very much.
When are you going to have your book ready?
I was the textbook that I wrote in. It's been published since January. What do you want with the book?
No, I'm not. It's not for myself. I'm going to get one for my dentist.
For your dentist?
And I was thinking last night if I could buy a few books and even give to the Kaiser doctors who have treated me for all these years, and the other dentists who have treated me in the previous years,
Okay.
they could help other people.
I tell you what, I'm gonna try to call the people where you can buy it right now and see if I can get you a discount.